Hey guys, welcome back to the Physio Bros. Now today, you have all been asking for it and we're going to tell you everything you need to know about how to manage your own shin splints.
Now this protocol is based off the evidence, the research and our clinical expertise, and it's really going to help you get your shin splints under control. So let's rip in. First off, what are shin splints? Now the medical term is called Medial Tibial Stress Syndrome. This causes inflammation to the muscles, the tissues and the bone, the periosteum, of your tibia or your shin bone. Now the symptoms or what you feel can be pain and inflammation along the lower 2/3 of the inside of the shin. Now this is an early bone stress injury on the continuum towards a tibial stress fracture. So obviously this is something that we want to deload, unload and get the inflammation under control early.
So if we think about the symptoms that you might experience if you have shin splints, is that it can vary slightly from person to person. So the pain itself can either be a sharp razor-like pain or it could even be a dull ache in that lower 2/3 in your shin bone region. Now this pain can be experienced during or after activities such as running. It can be very tender to touch if you're digging your fingers into that area, and it can also have a little bit of mild swelling around it too.
So guys, what causes shin splints? We know it's going to be associated with a sudden change in either your training volume, load, frequency or intensity. So guys, this is classed as an overuse injury. Now overuse is an interesting term. It means that you're currently performing a level of training that your body isn't currently conditioned to. And this change in intensity or training volume is causing an increase in your pain or inflammation in the bone or lower leg muscles. So in essence, the amount of your training load is exceeding what your body's current capacity is at. This commonly impacts runners, dancers, and military recruits. Now in these populations, we know that there can be larger training volumes and also larger ground reaction forces coming up through the lower leg, which makes you more susceptible to developing shin splints. So we know load management is essential for shin splints, but there are other contributing factors that can contribute. So not only is it the change in your training volume or load, but also weakness and poor flexibility in your lower legs. And then there's the other things that you might have changed recently. It may be that you've changed your footwear or a change in your training conditions, whether you've started running up and down more hills, doing more sprinting, or commenced trail running.
Now a quick disclaimer before we start digging into the exercises is that you want to differentiate between the potential of having a stress fracture versus just having shin splints. And an easy way to do this is to do the hop test. So basically what you're going to be doing is hopping up and down on one leg and observing the pain response that your body has. So if you're getting immediate onset of moderate to severe pain in those first few repetitions, then we'd recommend you getting a medical review to rule out stress fracture. However, if you're getting up towards the later stages, past 10 reps, and it's just a slow onset of your dull ache, then it's more likely that you just have shin splints. This is a really important test that we'd recommend you doing because if you do have a stress fracture, it's very different treatment and you're going to be wanting to immediately unloading that structure. So it's always worth giving it a try.
So guys, if you're in the early stages of shin splints, then prevention is key. We want to avoid going down that inflammatory cascade where you keep stressing and injuring the bone and the muscles supporting at your shin. So the most important factor is to include rest and to avoid those aggravating activities. Now if it is running, it may be reducing your training volume or performing intervals, and if that gets rid of your symptoms, then it's play on. By returning back to your previous more moderate level of intensity of exercise, that might be enough to reduce your pain and not going down this inflammatory cascade. But if you're still getting these developing symptoms, then it's really important that we add in rest and less ground reaction force exercise. So this could be doing something like swimming, cycling, and most importantly, the strength exercises which we're about to show you. Now in terms of the amount of rest or relative rest you need for this to improve, unfortunately the research just isn't quite there yet. So we don't have any specific time frames and you need to base it off how it feels. We know that for those people that push through and into this pain consistently, it can take up to 9 months for it to improve. And that's saying that if we can avoid going through this inflammatory cascade early, your outcomes and the timeliness of your rehab will be a lot quicker. Now aside from reducing the aggravating activities, there are other things that you can do to get some therapeutic relief.
Now we always recommend using the Peace and Love acronym for managing an acute injury, so make sure you click the link to learn more about it.
Other things that you can do to help increase support is sometimes wearing shoes even around the house will reduce the amount of pressure and give you a little bit of cushion, and that will reduce some of the inflammation and irritation. And guys, one of the most important things is do not not get a cortisone injection. This is something that has no evidence or anything to back it up for managing shin splints and should definitely be avoided.
Alrighty, so now that you've pulled back on those activities and addressing the amount of load that your body's under, it's essential now for us to start some strength exercises. Now these exercises themselves are going to be quite minimal in load, but really important in strengthening around the foot, the ankle, and the knee complex. So we're going to show you some exercises on screen now. Now these are very minimal load exercises, so you should be feeling not much pain at all, and there should be no lasting pain once you finish these exercises. We want you to aim for 3 lots of 10, and if you're feeling comfortable, feel free to progress that up to a 15 reps in a row if you like.
Now guys, before progressing to the next phase, here's a quick checklist that you need to do before progressing. The first thing is you should be able to touch or palpate through where you have been sore. Now you should be getting minimal to no discomfort. Secondly, what we're aiming for, you should be able to perform full range of movement in your ankle, as you can see, without getting an increase in your symptoms. Thirdly, you should be back to doing most of your activities of daily living without any discomfort. So as you're walking around the house, going up and down stairs, you should be quite comfortable. So ultimately guys, as a result of doing these exercises and unloading from your aggravating activities, you should be starting to notice an improvement in your symptoms. And that is a golden sign that you're ready to progress to the next phase.
So now you've progressed to the second phase of exercises, and basically from here we're going to include more weight bearing and increasing the strength in these muscles. What this is going to be essential for doing is going to be increasing the load capacity in your calf and your foot complex. It's going to improve your kinetic chain load capacity. And then lastly, you're going to be doing weight bearing exercises, which is going to be improving the amount of capacity that your bone can withstand. Now we're going to give you a range of different exercises for this, and you don't need to do all of them. We want you to handpick the ones that you might have the most difficulty with so that you can make the greatest amount of improvements. On top of these strength exercises, we also want you to continue doing those exercises that have low ground force reactions. So this could include your swimming and cycling as previously mentioned. So give these exercises a go.
This first exercise is aiming to lift the arch of your foot upwards whilst keeping the base of your big toe on the ground. Single leg balance exercises challenge the proprioceptive control of the ankle. Start off just on the flat, then you can add foam, and then you can add a movement task in this position. Soleus calf raises are done by having your knees as far over your ankles and then lifting your heels up to do the calf raise.
The Soleus bridge is a great lever lengthening exercise to challenge your posterior chain muscles. This also has a bias on your soleus. Soleus squat is a great isometric exercise to challenge both your soleus and quads, which help with force absorption when running. Now for the single leg calf raises, we're going to be doing the repetitions slow and controlled. You can even add weight to increase the resistance. We know with shin splints, having a strong calf complex is going to help reduce bony loading whilst we're running.
Single leg sit to stands aim to improve both knee control and quad strength imbalances between your legs.
Step ups are a great way to achieve high levels of glute max and meat activity. Now your glute med is so important for force absorption during the stance phase of running. By doing single leg exercises like this one, you're going to get all the proprioceptive benefits, which is great for this point in your program.
Step downs are great for improving both glute and knee control, as well as biasing load onto the patellar tendon.
Hip hitches are relevant for anyone who has weakness in their glute med. This exercise is aimed to help you reduce your pelvic drop during the loading phase of your running. Now the side lying leg lifts is a great progression from a side plank. This is going to help target your glute med without getting co-activation through your hip flexors. Now if this is getting easier, you can add in holds, or you can even add a band around your ankles to really promote strength gain.
Now just remember, there's actually minimal high quality evidence available for managing shin splints, and what this program is based off is the available evidence around foot and ankle rehab. So with these exercises, we're going to split them up into 4 different body areas: your foot, your ankle, your knee, and your hip. Now from these areas, we want you to pick one exercise from each of them for you to complete so that you can make sure you're strengthening up each of those areas. There's a lot of exercises provided, so make sure you pick the ones that are quite challenging from you because you're going to see the most improvement. Now you may be doing these exercises for 1 to 2 weeks, weeks, but we've also got a checklist for finishing phase 2 and starting the next phase of your rehab. So if we think about that quick hop test, I want you to be able to do 15 in a row with very minimal or no pain or discomfort. Next up is your calf strength. I want you to be able to do 20 repetitions in a row of a single leg calf raise. And then lastly, if we consider your activity, you should be able to walk for 30 minutes with no pain at all. Now, one of the most important phases of lower leg rehab, especially with shin splints, is going to be introducing plyometrics or power-based exercises into your routine. Now, the most optimal time to do this is before you've returned to running, but after you've done those 2 phases of strengthening that we've previously discussed. So why plyometrics are so important is they actually mimic the higher forces and load that are attributed to running, but what they do is you can do those exercises without the sustained repetition. This is a great way to reintroduce high load activities into your routine and improve the capacity of your bones and muscles to adapt to that load. So with these exercises, we're going to split them off into double leg and single leg activities and just handpick 1 or 2 of each of those, and you can add these to your strengthening routine or your other general activities like swimming and cycling.
The next phase is all about your return to running. Now, the idea of this is to increase the amount of pain-free training and running that you're able to do. To do this, we're going to use intervals. The idea is that you're going to be alternating between a rest period and an active running period. Now, when you start, you might need a longer rest, so a longer walking period, and over the program, you're going to slowly reduce your rest and increase the amount of active running. Over the weeks, you should be getting closer and closer to a more continuous run, and that way you're going to gradually build up your training load through the use of intervals. Now, this may vary person to person based on your running experience, so it's really hard to give you a set structure to follow, but just use those principles to help guide your return to running. So guys, with your return to running, it's really important that you start reducing the amount of plyometrics. You can, however, continue with your strengthening exercises as a great way to maintain your lower leg conditioning. So guys, if you were new to running when your shin splints started, then we do have a running program that you could follow that was based off these principles. It's a 0 to 5K running program that looks at increasing slowly your active periods of running, building up towards a 5K continuous run. Now, if you're someone that's more of a seasoned runner, then it's really important that you just listen to what your body's telling you. On your return to running, it may be starting off with a 5-minute on and a 2-minute rest period, and then just gradually building up from there. The most important part, whether you're a beginner or a more seasoned runner, is listen to what your body is telling you as a great way to guide your return to running. Now, we don't expect 0 out of 10 pain with your return to running, but it is really important that you monitor your symptoms, as your symptoms should not be worsening and growing with your increase in activity or training. So an acceptable amount of pain is 3 out of 10. Now, this should only come on during the run and should stop relatively immediately after finishing. Now, if you do get your pain coming on and it is persisting, then it's really important to either reduce your running volume or intensity or training load and go back to some of the more strength-based exercises. Another really important variable on returning to running is your training frequency. For example, if we look at your training week and we use the example of just 1 hour total of running, instead of doing 1 hour on one day of the week and resting for the rest of the week, it's going to be better to break that down into smaller blocks. So for example, doing 4 15-minute runs is going to be a much nicer way for you to build up your conditioning and the load capacity within your shins. And that's going to reduce the risk and likelihood of getting a recurrence or a flare-up of your symptoms. So in principle, what we're aiming to do is spread out the runs throughout the week. So your frequency of running is going to be higher, but the time of each run will be less, which allows for your body to adapt properly to the change in running volume.
Now, a really important factor to consider with your running technique is thinking about your cadence when you're returning from injury. Now, cadence is the number of steps that you take per minute when you're running, and it's really important to try and increase your running cadence to reduce your risk of injury. The lower the cadence is, there's more of a tendency to overstride, and that will increase the ground reaction forces going through your legs, which can lead to overloading. Now, the normal range for cadence that we want you to be aiming for is between 165 and 180 steps per minute. As you increase into this range, what it's going to be doing is going to be reducing your step length, which will ultimately reduce the loads going through your bones and associated muscles as well, and this will allow your body to adapt in a more effective way. If your cadence is lower and you need to increase it to get into that range, we don't recommend increasing it by more than 5 to 10% at a time. A great way to improve your cadence is by using applications that have a metronome on your phone, so they'll play the metronome in your ear, the beeping away, and you just time your step with that beep. Another thing you can consider as well is finding music that has that beats per minute and running to the beat of the music. Ultimately, considering and changing your cadence to those higher levels is a very evidenced way to reduce the amount of load going through your legs, improve your symptoms, and ultimately make a smoother transition to your return to running.
Now guys, if you have any questions on the more specifics of returning to running and the intervals that you should be doing, then 100% leave them down in the comments or DM us on Instagram and we'll get back to you so we can discuss it further.
Alrighty guys, so you've started back at running, you've completed the intervals that DB said with increasing the amount of running and reducing the amount of rest, and you might be roughly now running about 30 minutes continuous running. The last part of the program is returning to unrestricted running and returning to those activities that you love, such as hills, sprints, or trail running. A really important principle to follow here is making sure that your total volume of each week when you're progressing is not exceeding a 10% increase in volume. By this point, you should be running pain-free, you should be doing at least 30 minutes continuous running, and this is where you can start transitioning and including those different types of running activities that we previously mentioned. A key point here is just remember, always listen to your body when you're making these progressions. We want this to be the phase where you're not recommencing that inflammatory phase, so take it slow and good luck.
Now, for all you everyday athletes, that's everything you need to know about shin splints, and hopefully this will get you back to pain-free running.
Now, we base our content here at the Physio Bros on what you want to learn and what you want to know. So make sure you drop in the comments if you're having any other issues with your training, aches and pains. We want to hear about it so we can help you out. If you like today's video, please help us out by hitting the like button, subscribing, and we'll see you next time.